at least 1/4 of diabetics will develop a diabetic ulcer in their lifetime. And what makes it so sad is that this is something that is preventable. You can stop this from happening. So please let me know in the comments if anyone has given you any information at all about diabetic foot ulcers, what they are, if you're at risk, and how to prevent them. So in this video, I'm going to talk about what diabetic foot ulcers are, how they come about, how they can be treated, and how they can be prevented. So what is a diabetic foot ulcer? A diabetic foot ulcer is simply an open wound, that's an ulcer, that occurs below the ankle, that's your foot, in a person that's diabetic. So why does diabetes increase your chances of getting a wound that won't heal, that just gets bigger and bigger and becomes infected? The main symptom in diabetes, the hallmark of diabetes, is high blood sugar. And this high blood sugar causes a lot of damage all around the body. So first of all, it affects your nerves. Your nerves are those entities in the body that allow you to experience your internal and your external environment. Internally, you feel pain. So if something is happening, you can feel it. Your nerves also help you to experience what's happening in your immediate external environment. You can feel warmth, cold, touch, pain. In diabetes, the nerves are damaged. So that means that if something happens to your foot, if you have some kind of penetrating injury or you stub your foot against something, you won't feel it. And pain in particular is something that alerts us to a problem. In diabetes, because of that nerve damage, you lose a lot of these protective mechanisms. So you may get a wound, you don't pay any attention to it, and the wound gets bigger and bigger and bigger. And of course, any open wound is a playground for bacteria. So obviously that wound is going to get infected, and that is going to be a problem. Now, another problem that occurs is with your blood vessels. Your blood vessels carry nutrients, oxygen all around the body, including to your skin. What happens is that all those things that particularly the protein that would have helped to build that wound back up, to help it to close up again, they're not getting to the wound. Another problem is with the skin, the tissue itself. Now, in diabetes, because of that very high blood sugar, the sugar goes into the tissues and actually attaches itself to these tissues. This is a process called glycation. When sugar attaches to the tissues, it doesn't allow them to come together to form that kind of matrix that would help the wound heal and form that complete layer the way it's supposed to be. So you have a problem with the skin. Then we come to the immune system. Your immune system is that system that protects you against foreign invaders. Now, we're not talking about human beings here. We're talking about microorganisms. That would be bacteria, viruses, etc. Okay? Unfortunately, here again in diabetes, the immune system doesn't function properly. It doesn't do what it's supposed to do. It doesn't fight the bacteria that are invading that wound in the foot. So of course, the bacteria continue to multiply, to grow, and the infection spreads gradually. And yet another problem is with the skin. The fact that the skin in a lot of diabetics is very fragile and delicate because of the lack of nourishment, again because of the problem with the blood vessels and also in part problems with the nerves. The skin isn't as tough and resilient as it's supposed to be. So it's easily injured. Any little thing that touches the skin starts to break down. I've gone to the trouble of explaining all the things that contribute to the diabetic foot ulcer because I want you to understand that this is something that has so many factors contributing to it that you're better off not getting that ulcer in the first place than trying to treat the ulcer and get it to go once you have it. Why the feet? That's a question you might be asking. Your feet have to carry the whole weight of your body. Your feet are close to the ground. All sorts of objects that might be lying around, you may bump into them, you may trip over them. All those things make the feet very, very susceptible to getting wounds. So what are the conditions and behaviors that put you at higher risk of developing a diabetic foot ulcer? Very high on the list is walking around barefoot. I appreciate you may want to feel close to nature and walk around without anything on your feet, but that is high risk behavior if you have diabetes. The next thing is wearing shoes that don't fit properly. That can cause a lot of problems. Not washing your feet properly can contribute to this because you may have a small wound that you don't really know is there. The next thing is your toenails. If you tend to cut your toenails down into the corners, then it's easier for you to get ingrown toenails, and these can easily become infected. Now, if you're having problems with your eyes and you're diabetic, then it's possible that you've already started developing problems with the small blood vessels in your body. And of course, if you're having that in your eyes, then it's quite possible that you're having it in other places as well. So you may be having it in your kidneys and so on and so forth. And that means that it's also likely that you may be having it in your skin and in your feet. If you have heart disease or if you have kidney disease, then you're at greater risk of developing a foot ulcer. If you're obese, you have a higher risk of getting an ulcer. If you smoke, that's another thing that may contribute to you having a foot ulcer. How do you treat diabetic foot ulcers? A diabetic foot ulcer is not the kind of thing that you take some local herbs and leaf and slap on the wound. No. A diabetic foot ulcer is not a condition in which you solicit remedies and opinions in Facebook groups and WhatsApp groups and online forums. No. A diabetic foot ulcer is not a condition that you treat at your local chemist. That is a no. This is a serious life-threatening condition. A study was done recently where they looked at all the diabetics that came with foot ulcers to 4 teaching hospitals. Now, during the course of that study, 40% of the people who came, who presented and who were treated, had their wound heal. They recovered and they left. Now, what happened to the other 60%? 60% of the people who presented to these 4 teaching hospitals either ended up with an amputation or they died. Now, the reason I'm emphasizing teaching hospital is because these are specialist hospitals. These are hospitals in which these patients were treated by teams of doctors, teams of specialists, and still only 40% of those wounds healed with intensive management. This is something that needs specialist care. So what's actually done during the treatment of the diabetic foot ulcer? First and foremost, of course, a lot of these problems were caused by the high blood sugar and so on. So the blood sugar has to be controlled. That's the first thing. Another thing is that's encouraged is bed rest, which helps to take pressure off the wound. Then, of course, antibiotics will be involved to fight the infection. Dead and decaying tissue will be removed. Because of that problem with wound healing, even with all these measures, the wound may not be able to come together, or the wound is so big that there's no way that the edges are going to come together. So in this kind of situation, you would need a skin graft. Skin is taken from another part of the body and then is put over that open wound to close up that deficit. Ultimately, to save life, because if the infection has spread so far and the foot has actually decayed, then of course amputation. So how do you prevent a diabetic foot ulcer? How do you make sure that you don't get one? The first thing in preventing it is to control your blood sugar. That is the origin of all these problems. The next thing is that you need to check your feet every day, and you can use a mirror to look at the sole of your feet, the underneath part of your feet, or you can get someone else to help you. Now, you're looking for any wounds, bruises, cuts, any changes in color in your feet. That can alert you to the fact that something is going wrong, and then you can get help. Now, the next thing is that you need to wash your feet carefully every day. A gentle wash with soap and water. You don't need disinfectants and all that. Just soap and water and a soft brush is just fine. And after washing your feet, you dry them thoroughly, and pay particular attention when you're drying to the spaces between your toes and then underneath your toes. Those are the places that tend to get sweaty and stay wet. Then remember, we're trying to keep the skin supple and moisturized. So you apply lotion to your feet. You're going to apply that lotion to the top of your feet, the sides of your feet, and the sole of your feet. You're not going to apply the lotion between your toes. What you apply between your toes is powder, something like baby powder. Apply that between your toes and underneath your toes to help them to stay dry. If you wear socks, try and make sure that you wear cotton socks. They allow air to circulate, they are breathable, and they absorb moisture so that if your feet sweat, the socks can actually soak up some of that moisture so that the moisture doesn't stay on your skin. Check your shoes before you put them on. Check for sharp objects, anything sticking out from the shoe that may cause an injury that you may not take any notice of. When you're trimming your toenails, trim them straight across. Don't go down into the corners. That way, when the nail is growing back, it doesn't grow back into your flesh. And when it does that, then there's a greater chance that it will become irritated and infected. Don't walk around barefoot, even if you're indoors. A lot of accidents happen indoors at home. Always make sure that you have something on your feet so that even if you step on something like a pin or some sharp object, at least there's your slipper or whatever it is between your skin and that object. So even if it gets to the skin, it definitely won't be as bad as if you weren't wearing anything at all. And then if you smoke, this is yet another reason why you shouldn't. So please share this video with your family and your friends. There are so many people that need to know about this, and by sharing this with them, you would be doing them a huge favor. I'll see you in the next video.